Hello, I am Dr. Avyas, and today we will discuss another chest X-ray. As we have started our pulmonology series, today we will discuss another topic, and that is very important. And you will see a number of cases related to that topic. So today we will cover a very important topic. So can you spot abnormality in this X-ray? I give you 5 seconds. Right. So you can see there are bilateral. You can see over here. These are, you can see micronodular. These all these. This one micronodular opacities. This one and this one. You can see my pointer. You can follow my pointer. That is following all these reticular micronodular opacities. You can see this one. These all. So can you guess now diagnosis? Yes, this is a classic case of hypersensitivity pneumonitis. Whenever you see a micronodular opacity bilateral, you can always make a diagnosis hypersensitivity pneumonitis. As I have told you earlier, always correlate with clinical finding. Always. So this was an X-ray of a 16-year-old girl who presented to us with chest tightness and shortness of breath after she visited an animal farm. So when we inquire about her history, she told that she suffered similar kind of feeling. Chest tightness and shortness of breath are 3 year back. When at that time she also visited the animal park. So you can also, and her brother is also having allergic history. Yeah, her brother was having a asthmatic attack. And she's having also a skin disease, eczema. So these findings, give you a lot of hint. But when I escalated her, she was not having any wheeze. So I ruled out asthma, right? So ruling out asthma, the other finding, what will you see? So whenever you see a patient who is having acute onset of symptoms after going to an animal park or organic and having a fine inspiratory crackers, right? Fine inspiratory crackers. These are also a classic finding for hypersensitivity pneumonitis. And remember, now you will see that how you will differentiate between an asthmatic attack and between hypersensitivity pneumonitis. So there is, a very important clue that I will give you today. You will see a restrictive pattern in hypersensitivity pneumonitis. But in asthma, you will see obstructive pattern. For example, if you are confused between asthma and hypersensitivity pneumonitis, and you are not able to find any conclusive on chest auscultation, you will do a spirometry. When you will do spirometry, you will see FE1 ratio and FVC ratio will be normal or increased. This will give us a diagnostic clue for hypersensitivity pneumonitis. Okay, when you see on X-ray, you will find these micronodular opacities, right? These one. You can follow my pointer, that hand pointer white one. These are the classic for hypersensitivity pneumonitis. So whenever any young adult, for example, a 16 or teenage child or boy comes to you and you say that he was visiting a farm, and during that visit, uh, you know, after day he develop any shortness of breath, you will see his chest x-ray and you will find these opacities. Your diagnosis should be hypersensitivity pneumonitis, right? So if I summarize all these things, you can easily diagnose this important clinical disease, hypersensitivity pneumonitis, whenever a young child comes to you with acute onset after exposure to animal or organic exposure and having a fine inspiratory crackles, and on a spirometry it shows a restrictive pattern, you should consider it hypersensitivity pneumonitis, right? So this is a classic case and you will able to diagnose, right? In a medicine you should diagnose. So this is very important, right?